I'm Dr. Heather Moore, owner of Total Performance Physical Therapy. Today we're going to go over a little bit about hip anatomy, why some of the reasons you could have hip pain are. So you're here because you either found us on Facebook, YouTube, the web, you got referred here by your doctor or friend. Somebody told you to come and check out our video series, this one being on hip pain. And kudos to you for kind of taking this first step and finding out exactly what is going on with your hip. Finding out the cause is a major stepping stone in actually getting better. So you want to, give yourself a little pat on the back for that. And if you've seen any of our other video series, thank you for watching those. So what we're going to do today is we are going to go through, kind of talk about the causes of hip pain. And what could be causing your hip pain. So chances are you're here because you're experiencing some either back pain, hip pain. Something is not right in your hip and back area. So you found our video and trying to find a cause for this. So the hip is a very complex joint, and it's complex in terms of it really. It's not the hub, that's the nape, but it brings together the back and kind of the lower extremities. So it's a ball joint, all right? So here is your hip, and then here is your pelvis. So when all these muscles come over and attach, and things like that. So, and the difficulty with the hip, and it's not a difficulty, but it's something that causes it to be a little bit more susceptible to injuries. It moves all around. So where your knee only bends forward and back, your hip can bend, it can rotate, it can do all sorts of positions. So you wind up with some things like tears and various things that could go on in your hip that may cause you pain. So the first one is a labral tear. So as someone just said to me, well, I had shoulder surgery and they were repairing my shoulder. Same thing. Same label. The only thing is that for labral tears in the hip, they generally do not operate. There is operations out there, but they generally will not do the operation. Especially because a lot of times with physical therapy or some other guided medicine, you can overcome any issues you're having with the labral tear. A lot of times labral tears are operated on immediately with athletes who need the benefit of that hip capsule to be effective. So you may be walking around right now with a labral tear, you may not know it, or you may be one of those people where your surgeon said it's not worth it, the risks are too great, to go in and get it. But the labrum is just a lining, so the ball of the hip just kind of rests on lining. Okay, and then lining is your labrum. And sometimes you get a little hiccup in there. It's literally a tear. Sometimes it's big, sometimes it's small. What you're going to experiencing with this is sometimes you'll get clicking in your hip. Not always, but sometimes. Sometimes you'll feel a stutter as you move. The only real way to diagnose one of these is through an imaging study. So there are certain tests that we can do in the clinic to kind of look at it, but if this is what's suspected, you really need more of an imaging study in order to look at that labrum. But again, even when somebody comes in and they say, I think I have a labral tear or I have a labral tear, we look at a lot of other issues. We look at a lot of other factors because a lot of times labral tear, once we get through all the other things, we find out, well, there might be a labral tear, it wasn't really causing you any issues. It was everything else that was causing you issues. So there's really no good test that we can tell you to do at home to diagnose this. This is very rare. It is very rare that this would be impeding anything in terms of function. So if you've got a lot of pain or you have trouble walking, while this may be part of it, this is not going to be the cause of that. So number 2, this is a big one, all right? This is a big one that I get asked a lot about. Hernias and groin strains. How do I know the difference? How do I figure out which one it is? And it's a very, very popular thing to have go wrong. So hernias and groin strains are two different things. okay? But the presentation and how you feel is kind of the same. So groin strain, you're going to get pain just on the inside of your thigh. Sometimes it can come all the way up into your pelvis region and go all the way down into the inside of your knee. That's a groin strain. That's a groin pain. Now with a hernia, you may feel the exact same thing. A hernia is going to happen in your stomach, and it's going to be a protrusion. Now if you have a hernia, or a hernia develops, it is something that is surgically treated. It is something that we can do more conservative procedures, but it is something that is more popularly treated with surgery. Now, a groin strain, and you may have both of these going on, and that's where it really gets complicated. So with a groin strain or groin pain, what you're going to want to do is, you're going to want to feel literally around your groin, all the way down. Now, as I do this, and as I'm feeling that muscle, and I'm feeling all the muscles on the inside of my leg, it doesn't feel like anything. I'm putting a lot of pressure there, and I feel my fingers in my groin, but that's about it. There's no pain, there's no discomfort, like it doesn't feel like anything. So if I was experiencing pain and it was going down and it was shooting down into my pelvic region, but I was touching, and I'm like, yeah, I don't feel anything, it's more likely a hernia, okay? Now, in order to diagnose a hernia, this is another thing that's going to be done on imaging. While there can be, sometimes you get your fingers in there and you feel a hernia, the chances that you're going to be able to relax enough, especially when, jamming your fingers into your own stomach, the chances that you are actually going to be able to feel a hernia is very slim, okay? So a lot of times what will happen is that your fingers start to go in, you're going to contract your abdominals. It's only natural. So you're not going to really feel anything going on in terms of a hernia. But if you feel down here and you're like, this is, and you're feeling your abductors and they absolutely hurt to the touch, you've definitely injured your groin. Having a hernia does not cause groin pain. Okay? Having a hernia does not, if you all of a sudden, have a herniation, it doesn't automatically make the muscles in your groin sore. So if you have groin pain and you can touch your groin and it's really tender, you might have two things going on, or you might just have the groin strain going on. But there's definitely a groin issue if you can touch it and it hurts. And if you touch it and it doesn't hurt, you're looking more towards a hernia. If you suspect it's a hernia, best thing to do is go get an imaging study. Get an MRI done, figure out what's going on there. Just to clear it, just to, kind of rule it out. Again, I know people don't do it a lot of times because they're so afraid of surgery. It's not something that automatically gets operated on. It's not something they're not going to let you leave the hospital before you get it fixed. Hernia surgery is 100% most of the time option. So a lot of times people can get away without it. Most people don't opt to, but a lot of times, it is a possibility. So the final thing is muscle guarding. So the hip is the center between the knee and the back. And, if you viewed a couple of our other videos, you're going to find that this is a big one for everybody. Now, the problem is with muscle guarding is it's not a primary cause, but it's a secondary cause that does a lot of damage. And a lot of times, by the time we are done fixing muscle guarding, we actually fix the problem. Okay? Even if this is a labral tear, even if this is a hernia or groin strain, once we fix the muscle guarding, the pain's gone, you're able to walk again, everything feels good. So this is always a big one that we look at first. We got to figure out where you're guarding, where you're compensating. If you have a herniated disc, if you have low back pain, you're going to walk a little bit more gingerly. You guard that side more, okay? Your hip doesn't move as freely, you're not running, etc. Okay? So when you start to not move as quickly or not move as freely, and you're like, oh, I'm just, I'm watching my back a little bit, your hip's involved in that, okay? So now what happens is you're starting to use the muscles around your hip differently. So then they develop knots, okay? Knots, trigger points, whatever you want to call them, all right? So as you develop these knots, they shorten the muscle. So your muscle generally will look like this, okay? Nice, like a piece of thread. Now, if you start to put knots in that piece of thread, it's not going to be as long. All right? So here you have your muscle now with knots in it, and it's not as long as it was before. Well, now it's starting to work like this. Well, now there's going to be more knots because it's not working properly. And here it is. So as time goes on and as these knots form, you start off with the muscle that's this long and go all the way down to the muscle that's, tiny, tiny. So how can your body still function the same way when it's used to having a muscle this long and now it's this long? If you have a piece of string that's this long that connects something and then all of a sudden it goes to this, the connection either gets broken or it can't do it anymore. Now, in the body, muscles do not tear very often because of trigger points. So what happens is this changes the way your entire joint reacts. This changes everything, okay? So now this muscle that used to be this long has to have your leg move in some aspect, only being this long. So you're going to get limping. You're going to get pain. You're going to get, you can't put your leg over, your knee. You're going to get difficulty putting your socks on. You're going to get soreness when you wake up. You're going to get a whole bunch of things, okay? So if you have pain in your low back and hip, and they are interchangeable, okay? A lot of times pain in your low back could be coming from your hip. A lot of times pain in your hip could be coming from your low back, but if you have pain, or specifically, one of the big ones is a pain in your butt. You're driving and you're like, I literally have a pain in my butt. That's a big one for the hip. Okay, that's a muscle guarding. That's all that is. All right, there is, things that we're going to show you how to do to kind of work on that guarding. But what you can do at home to kind of look at this is, we'll go through that in the next video, but you can see kind of where you're at if you have pain. If you notice yourself limping, if you notice pain, you've already probably changed the way you walk and don't even know it, and this is only going to snowball and perpetuate, the hip pain that you already have going on, and then probably move into knee pain and back pain and all those other sorts of things. So stay tuned for video 2. We're going to go through how to diagnose some of these on your own at home to see what's going on, and we'll look for you then.